My name is Craig DePriester, and I'm a former member of the board of directors for the Kidney Cancer Association. I got involved with the KCA in 2011 through a board fellows program at the Kellogg School of Management, where MBAs were enabled to go sit on boards and get involved and do kind of a project with these nonprofits. I not only took that initial project, but actually did a full independent study where I spent a semester really focusing on KCA and some of our clinical trial research strategies at the time, and then ended up joining the board full time post graduation in 2012. I think the biggest milestone that comes to mind for me is the transition of leadership to Gretchen about 7 years ago. We had a longtime CEO who had been under the stewardship for well before my time there. And, it was something that was a little bit contentious. There's a lot of different questions about the leadership, but there was no doubt that we needed to bring in somebody with a new vision and ability to rebuild the team, ability to invest. The KCA had always been successful, but I think was leaving a lot on the table in terms of what could it accomplish, and especially for still an underserved patient community. And so the late Dr. Wood and I spent a lot of time figuring out how to make that transition successful. And from the beginning, when we were interviewing candidates, it was clear that Gretchen was somebody with the passion and the skill set and the connections to be an effective CEO. And so that really set up the last few years and the kind of the next era for KCA in terms of prosperity and mission. The kidney cancer landscape has changed quite a lot since my involvement started about 15 years ago. I think when I first joined the Kidney Cancer Association, there was largely a lot of surgical interventions that were relied upon, and then there was starting to be more pharmaceutical interventions, but it was very limited. And over the last 15 years, we've seen a real proliferation of new treatments, new adjuvant therapies, new research, new principal investigators, and young researchers getting involved into this space. And it's created a lot of patients uh, who would not have survived 15 years ago. And, I have a personal friend who I think, recently came down with kidney cancer, and the treatments that he received are things that did not exist 10 years ago. And so I'm personally really grateful for the advancements that have happened in this space. And I know the Kidney Cancer Association, while not directly funding all of this research, has built really meaningful partnerships with pharmaceutical companies, has helped start careers and fund grants that have driven principal investigators to get involved, and I think has been really a super connector. And those types of things really go a long way in getting decisions on the margins made in favor of patients and in favor of research. So when I think about the future of kidney cancer, I hope it's much more precise, more targeted medicines, more immunotherapy type things that really will enable an even more surgical approach to treating these illnesses. I think that we're already seeing the benefits of things like gene sequencing for tumors that did not exist a decade ago. And the more and more we can start to take this now really wide spectrum of drugs, both for kidney cancer as well as for other cancers that would benefit that would benefit kidney cancer patients. How do you then start to turn that into more and more of a um, thoughtful, evidence-backed algorithm almost that enables people to get the best treatment early, and take some of the guesswork out of it? And so I think when you think about the demographic changes that are making kidney cancer more and more prevalent, as well as kind of the myriad of treatment options, I see a lot of opportunity for innovation, building upon what we've seen for the last few years.
Perfect. And what role do you think the KCA kind of plays in that evolution?
I think the KCA continues to play a role that it has, funding new research, partnering with the medical community, partnering with pharmaceutical companies. If anything, I think the KCA has had a number of attempts to try to have a heavier hand. When I was looking back initially in business school, we were looking at tissue banks. We were looking at creating clinical trial infrastructure. We were looking at partnering with other kind of cancer nonprofits that were also well funded. I think looking at the Pancreatic Cancer Action Network and what that they've been able to do with an even rarer cancer, there's a lot that we can do to build, but a lot of that relies on money, on expertise, and on infrastructure. And so the direction the KCA is going will enable it to have option value to take advantage of those things. So I'm not sure what the big lever the KCA will pull that will help patients over the next 5, 10, 15 years is, but I know that it will be there when that opportunity is ready, and there will be a community that's ready to pounce and help provide new treatments and new ways of making sure the patients have the best experience and the best outcomes possible. It's really meant a lot to me to be a member of the Kidney Cancer Association for almost a decade and a half. It's something that has seen me grow tremendously as a person. My children weren't born when I joined with the board, and so I've seen, as a measuring stick, I've seen all of this personal growth as well as professional growth, and seen the organization blossom and flourish. From a personal perspective, it's really helped me grow as a leader. It's something where I've gotten a lot of experience being on a board, learning the parliamentary processes, helping drive effective governance. I mean, those are things that I feel like my voice now versus where it was when I joined, it's just completely different. But then also just from a mission and values perspective, being able to help drive a organization that fights this fiercely for patients and is driving outcomes for a undertreated disease, and advocating for people who need help. That's just been a real privilege to be a part of. That's the most important thing, is that as I've gotten to feel like we've had an impact on this space and people's lives are going to benefit. And I feel, certainly was sad to roll off the board. I think it was a really important experience for me and on a lot of different levels, but I know the Kidney Cancer Association is in great hands moving forward.